Hi everyone, I'm Dr. Heather Hirsch and welcome back to my YouTube channel, Health by Heather Hirsch, where we discuss all things menopause and midlife. If this is your first time here, hi, so nice to meet you. Welcome to the group. I am the clinical program director of the Menopause and Midlife Clinic at the Brigham and Women's Hospital in Boston, Massachusetts, where I would love to see you if you live in the state of Massachusetts right now. But since I can't see all of you, I have set up this YouTube channel and several other resources to help spread awareness, education, and advocacy for all my midlife warriors out there. Today, we're going to be talking about hormone therapy, tab versus patch. I get this question a lot, and I just want to have the floor to put my pros and cons out there on both of these really good options. So we're going to be talking about that. There are several other places you guys can join and follow me if you don't already know. I'm on Instagram at hormone.health.doc. We have a fun interactive community over there where you get to vote on lots of things and sort of see what I'm up to on a daily basis. I'm on Twitter at Heather Hirsch MD, and I have my own website, heatherhirschmd.com, where you can find things like my ebook and my course, which is a really nice deep dive into all of this laid out there for you with things that you can tag along to your learning, like PDFs, downloadables, worksheets, etc. Really, really awesome. And you can find that on my website, heatherhirschmd.com. Click on the course button and that will get you right there. So I wanted to jump off my videos with a new thing where I talk about my current favorite product. And I thought this would be fun. I have a video on some of my favorite midlife products, which I will link. And so many of you loved it. So I decided before every video, I might just feature one of my favorite products. And I take this job very seriously because I really only recommend things that I use and I love, and certainly not in a prescription medication fashion. I'm talking about over-the-counter things that I think that you will find helpful. So today we are featuring the Pause Well Aging Facial Massager Collagen Stimulator Extraordinaire. So this is what it looks like. You can see it has the Pause Well Aging. That's their little logo, the 3 dots. And it's really, it's this nice metal. So it's really thick. The way I use this, and I absolutely love it, I use it every single day. I put my moisturizer on. There is a Pause Well Aging Collagen Boosterizing Moisturizer that it comes with. And then once you get your skin all nice and creamy, you take this side or this side, and you're just gonna go up and down. Oh, and it feels, you know, I also have some TMJ, so I'll rub it up there and it feels really good. And then do the same thing on the other side. You can also get your neck and things like that. And I'm telling you, I use this, I absolutely love this product. I'm gonna put a link to this down below in the description bar if you're interested in looking it up. So amazing, as well as the other Pause Well Aging products, but this baby is truly my favorite. All right, also, if you've been following me for a while and you haven't subscribed, please do. That helps this YouTube algorithm know that these types of videos are important, specifically for women searching for things on menopause. So that helps my channel get boosted to other women who may not otherwise find it. So please go ahead and subscribe, give this video a thumbs up, and certainly any comments that you might have. Let's get into the juice for today. So today I want to talk about oral versus patch if you are considering the use of hormone therapy. Now, I have several other videos on the safety of hormone therapy, which I will also link here. I have a video on which type of hormone therapy is right for you, which I will link here. So I don't want to go back over those, but certainly if you're new here and I'm jumping ahead and you're like, wait, hold up, is this safe? Is this right for me? I would definitely have you check those 2 videos out. So certainly the sort of overarching basis that most menopause experts follow is that hormone therapy particularly has benefits for women who are symptomatic when they start within 10 or 5 years of menopause and they have no known contraindications to estrogen replacement. Now, not everyone wants to take hormone therapy or chooses to take hormone therapy. It's always a patient's right and choice to decide what's right for them. However, I consider it my duty to sort of break down the myths and the barriers that certainly help women uncover how how better they will feel on hormone therapy, and what the risks might be to their health if they don't take it and they continue in the state that they're in. So anyways, if you do choose to use hormone therapy, and you're sort of in that age window, in that age group, let's talk about what would make you pick oral or what would make you pick the patch. Now, no known contraindications, hard stops, things that are contraindications are in history of an unprovoked blood clot, meaning just sitting watching TV and having a blood clot, different from a provoked blood clot, which is something like after a massive car accident that can be considered different depending on the circumstance, a history of a lung clot or a pulmonary embolism, a history of known or active breast cancer, and undiagnosed vaginal bleeding are hard no's. Okay, certainly there's some other things that can be questionable if you have a complex history, and that's where a menopause expert comes in great handy. And I also just want to shout out the menopause.org website run by the North American Menopause Society, of which I'm a member, and so many of my mentors and other leaders across the country in menopause are involved in. And so again, that's menopause.org, and you go and search for a provider, and that's how you can find somebody, hopefully in your zip code, if I'm not in your zip code. All right, so you get to the point where you say, I feel safe, I feel comfortable, and I feel confident, and I want to proceed with hormone therapy. In my office, what I do is sit with my patients, and I first just listen to what their symptoms are, listen to what's been going on, how long have they had symptoms, what's their most pervasive or persistent symptom, are they daytime, are they nighttime, is it affecting work, is it affecting their relationships, is it all of these, some of these. That's so helpful when you're sort of beep, bop, boop, what's going to be the right thing for this patient as the physician. So history is important. Your medical history is important. Do you have metabolic conditions like high blood pressure, diabetes, dyslipidemia, or elevated triglycerides or cholesterol? Also important to ask, especially for cardiovascular health, is any obstetrical complications such as gestational diabetes, gestational hypertension, preeclampsia, preterm delivery. Those are all really important to also sort of take into mind. And those are some of the cardiovascular risk factors that are specific to women that are often under-recognized. So that's really important. And you also want to think about the patient's lifestyle. Are they night shift workers? Are they bad at taking medications? Do they want something on their skin? What is sort of their lifestyle and their preference? And then you also want to look through their other medications. What are they currently taking by mouth, and etc. So I'm going to start with why the patch has become so popular. Well, so the biggest risk of hormone therapy is actually the rare risk of a blood clot. It is highest in the first 6 months and then tends to dissipate over time. Now, what is so cool about women in midlife is they've often given their bodies little stress tests along the way. So the risk of blood clot is actually a little bit higher when you're using than postmenopausal doses when taking combined oral or the patch or the NuvaRing contraception, or otherwise known as estrogen progesterone combinations to prevent pregnancy. So if you were on the pill for say 1 or 2 decades, certainly you've already given your body several years of stress tests. If you never had a blood clot then that's a really good indicator. Other things that are things that I can think about in someone's history, if they had surgery, if they had pregnancies, those are big times for risks for blood clots, and all those little stress tests or micro tests can tell you what someone's history might be. Now, a lot of you asked me about family history of blood clot. Important, but it's a data point to log. It doesn't necessarily mean that you are definitely going to have a blood clot, but if a family history of blood clot is present, that might trigger me to check for some of the really common genetic mutations that can increase your risk for a blood clot, and that would be something like factor V, Leiden mutation, or some of the other really common coagulable mutations, and I will check for those too. So there was a study that came out looking at the transdermal patch and found that the risk of blood clot was lowered even further. So the risk of a blood clot is about 1 in 1,000 women taking oral and reduced to 1 in 2,000 women taking the patch. Now remember, 1 in 1,000 is also extremely small risk. So 1 in 2,000 is even smaller. So at that point, when that study came out, what I tended to find is, even though there was a little bit of misconception about hormone therapy, many people thought, well, if I'm going to give hormone therapy, I'm going to give everyone the patch. Okay. Secondly, we also know that the patch avoids first pass metabolism. That means it's not metabolized in your liver. Now, not all medications are metabolized in the liver. In fact, most are actually metabolized in your kidneys. The renal system is metabolizing them. There are certain medications that are metabolized in the liver that are quite important. Antifungals, anti-seizure medications, antibiotics, birth control pills that are metabolized in the liver. And so a lot of people also think that the patch has definite benefits because it's avoiding first pass metabolism. And again, this is true. So the patch has some pros. It decreases your risk for blood clot even further when that risk is overall very small, especially if you haven't had a blood clot when you were on birth control pills or had 2 C-sections or had your shoulder surgery and you did fine. So, the patch does lower that risk for blood clot in studies and also avoids that first pass metabolism. So those are sort of its pros. Now, its cons are that, well, you have to put something on your skin. Now, some people love that idea. They might be night shift workers and remembering a daily tab is really hard to do, or they may really not like medications. And so this is a good way for me to sort of change their habits because they're just kind of popping it on their skin. There's a weekly patch. There's weekly patches and then there's twice weekly patches. And those are really the 2 kinds of patches here in the United States. So that also means you've got to remember to take it off if it falls off or it's not sticking or it causes a reaction on your skin. Those are also things that we don't want you to have, particularly if you plan to use this for a couple of years or longer. So the cons are that you do have to put it on your skin. You have to remember to change it. If it falls off, you're kind of in this weird zone of, do I put a new one on? Then I'll run out of my medication sooner. What do I do? Is it being absorbed still? I've seen people who put Tegaderm on their stomach just to keep it on. And again, that's where we're really getting into the cons, In my opinion, the patch is a great option for somebody who takes many oral medications, who may be taking those kinds of medications that are metabolized in the liver, and especially for those who have metabolic conditions before they're going to start their hormone therapy. For example, if they have well-controlled high blood pressure or they have a creeping up A1C into the diabetes range, then we actually know that the patch is much preferred. If you're completely healthy and you're choosing between the two, then you've got a little bit more options. But if you already have some metabolic conditions, I most commonly start my patients with the patch. It definitely just decreases pill burden. And again, that's really nice because it's going to avoid that first pass. It's going to avoid the liver. But again, I see this really as a great option for somebody who wants to take the patch, who wants to lower their risk for blood clots, or who has metabolic conditions, in which case I really do just urge them to try that first. All right. But again, the cons are that not everyone does well on the patch, quite frankly. So let's go to orals. In orals, there are many types of options. You can take a combined estradiol and progesterone. You can take a separate estradiol and a separate progesterone. You can take the estrogen every day and the progesterone days 1 through 12 of the month. If you want to lower the amount of progesterone that your body sees, and I'll actually put a video up here on when and why to take progesterone. You can do estradiol with an IUD. You can do conjugated equine estrogen. You could do Duvet, which is conjugated estrogen and beta-doxyphene. There's many oral combinations that you can use. And a lot of times when I ease people's fears who are really healthy and they have all the options, that I'll say, if you want to take oral, you certainly can. You take your tab once at bedtime or maybe once in the morning, once at bedtime, depending on your regimen. And people just sigh of relief. Oh, I can just take a pill? Yeah, Absolutely you can. Many of my patients are not on a lot of other medications. They're otherwise really healthy. They don't have diabetes or dyslipidemia. And so certainly you have the option to take an oral estrogen progesterone combination. In my opinion, well, before I say that, there are really no studies looking at pill versus patch. What's more efficacious? Because that's what everyone asks me. What would you do? What works better? There is no good studies to say that. And so certainly I can give you just my opinion or what I see anecdotally. But again, this is really just straight up my opinion. I do tend to find that the oral can sometimes be a little bit easier to titrate the right dose. The patch is limited in the doses that it comes in, unfortunately. Sometimes we end up going to an estrogen only patch, and then my patients take the progestin, again, if they have an intact uterus, and that's the way we have to sort of change the dose. So the patch can be a little bit harder to dose adjust, whereas orals can be pretty quick to dose adjust. Orals also tend to work really quickly and really efficiently and effectively because really every 24 hours you're taking your medication. So one thing to think about with the patch is if you sort of feel like it's wearing out over those 3.5 days or that 7 days, maybe you need a 24-hour type of option, in which case tabs are going to be really easy for you, or they just might steady those levels a little bit better. So they're easier to toggle for some people. They're a lot easier to do than the patch, and it fits with their lifestyle and it fits with their medical background when they come in to see me. So again, certainly this is not direct medical advice. It's so important to know that these are for educational purposes only. And when making a video like this, I do have to make some broad generalizations, and really the best type of care for you to get these answered is to walk through this with your menopause expert, your primary care or OBGYN or family medicine doctor. But for a lot of my patients who think that the patch is the only option out there that is safe or right for them, you certainly can use oral preparations if you have no contraindications to those. Now, there is also sprays and gels of estradiol, and while we're kind of not talking about those are also a 24-hour type of application that is transdermal. So for example, Divigel, which is estradiol, or Evamist, which is estradiol, those are nice, also 24 options that are transdermal. So there is some wiggle room in that gray zone in the middle. So really, that is sort of the overview of the pros and cons of the patch and pros and cons of the tabs. So I hope that was helpful and answered some of your questions. Feel free to leave some questions in the comments below. Remember, I really can't give direct medical advice, but I can try and give a broad overview. I don't think there is one right answer for any particular woman. I think it is such a unique type of medicine that I get to practice because it is really something that should be individualized based on the person's history, menopause, their obstetrical history, surgical history, chronic conditions, and medications that they're taking, their lifestyle, and their priorities and goals. So it is such a satisfying and really fun job that I have. All right, everyone, don't forget to like this video. Please give it a thumbs up. Subscribe if you haven't. Send this channel to a friend. You're welcome to watch as many videos as you can before you get bored of me. Remember, you can also find all of my information on my website, heatherhirschmd.com, and I love to hear your suggestions, your feedbacks, your comments over on Instagram. You're welcome to send me a message there. Y'all have a great rest of the week, and I'll see you next week. Bye.